Hi friends. Okay, real quick. Yes, I'm doing a treatment. I don't know if you can see it, but I'm on here because I got a call today because someone that I know's family is in the hospital with COVID, and they were asking me questions about certain things as the disease, not disease, I have a disease. The sickness, the virus is a lot somewhat similar as far as hitting the respiratory system. So if you I'm just going to give you some quick tips. Take them, leave them. I'll be honest with you, I don't know a lot about COVID, but I do know a lot about being in the hospital with a lung infection. And I know a lot about being in the hospital for 2 to 3 weeks. And I know a lot about needing rest and there are just certain little things that you can do. So I'm just going to give these tips out there because if she needs them, then I guarantee you that there's someone else out there that has never experienced what even close to what it's like. And I've been doing this since I was 5 years old. So for 30 years, multiple times a year. Okay. First of all, you are your advocate. And what's unfortunate is that there's no one in there to watch to make sure. And a lot of the patients are really sick. So if the person that you know is not able to vocalize because they're on oxygen and are very weak, then I hope that you are the person that can call and have the code and ask to speak to the charge nurse. The charge nurse is the one that's in charge. Basically what happens is there's 7 a.m. to 7 p.m. shifts for the most part, and 7 p to 7 a. Shifts change. We want the information to circle through. So for the first, I say they're in training for the first, few days to get to know you, to know what you need, what your specific needs are. I'm sure that there is a general need, but then we are all different. So make sure that you communicate as much as possible to these people to what you need. All right. Some basic elements of survival are you've got to have water. I always have a cup of ice water there and available. They've got techs that come in that can do that, but push the button, get you some water, stay hydrated and fluids going. A lot of times those antibiotics, the IVs, heat up my body, and it's just really important for me and for all of us to have a lot of water. Okay, second, you gotta have rest. You've got to have rest, and rest is not known in a hospital. A lot of times they will put in an order for a blood draw, and it could not be given at 2 a.m., but because it isn't specifically said, they just come in when it's convenient in their schedule. So I have quiet hours, and my quiet hours are from 10 p.m. to 7 a.m. No one is allowed in my room. And if they break that rule and they come in that room, I make it be known that this is not what they're supposed to be doing and to leave. Okay, this is not it. Now, if there is something that has to be done, a lot of time vitals have to be done, your blood pressure, your temperature, every 4 hours. I, in most of my stays, do not need that through the night. To me, it is more important to have rest than to check my blood pressure. So unless it is essential to life-saving, it does not need to be done while you are asleep. You need to advocate for that. You need sleep. They need sleep. That is when the body heals, is when we have sleep. Okay. Second, you've got to have food. And I can tell you, if you are on even one IV antibiotic, you're going to feel nauseous. And if you're on more of them or very strong, it is so it's terrible. So ask them for something for nausea. I take Zofran. They put it through the IV. It works. It may not take it all the way out if it's super severe, but it will definitely help because you've got a lot of pain. You can't breathe. And so to have anything else added on that is of discomfort is really difficult. So if you can take away even a slice of one of those, it's helpful. And you can take that pretty often. It's not like a narcotic or something like that. It's fine. Okay. Also, I don't know if it's available as far as, I don't know how COVID works. I don't know if they could actually come into the room, but you've got to eat and you're so nauseous and the last thing you want to do is eat. And a lot of CF patients have diabetes, and I know there's probably people that have to watch what they eat. So for me, I like liquid calories when I don't feel well. And a conversation with the dietitian who is in the hospital, and then that gets relayed to the doctor, or they have a conversation with the both of them to help you get nutrition into your body. We need food, we need water, we need rest. These are just a baseline of essentials to keep strength up, right? So they can have Ensures brought in. I have a protein shake brought in with every single meal, and then I have snacks that come in between those. Don't always eat them, but at least they're there. And for me, liquid calories, if I don't feel good, they are something that I can get down. And at least it's something. Like, it's something. You cannot starve yourself. So even if it's an ice cream or that's their job, to know what other sicknesses they have and to work with them. Okay, if they just have no appetite at all, there is a medicine called Magestrol. I take it, it works magic. It actually has a steroid in it, and they give it to cancer patients. So I don't know who is all available to have that. But it actually works with the receptors to take the wall out and allow those signals of, hey, you're hungry, you want to eat, to be attached. And it works. Like, it works big time. Like, I went from eating nothing to eating double portions in like a week. So it works. And I was still sick. Also, another one is Marinol. To me, it's THC. It's like smoking weed. It can help. It can help to decline the nausea and give you an appetite, but it's not so predictable in the time that it's going to start working. It a lot of times make you really drowsy, and it sometimes actually makes it kind of hard to breathe. So I would suggest doing the Zofran for nausea and the Magestrol for appetite, and then talk to the dietitian to get them some food. Okay. Also, what else was it we talked about? Breathing treatments. I don't know if they even allow them to do that or if it's even a part of it, but I suggested that. I think my biggest thing is to, as a family member of someone who is in the hospital that has COVID, or a friend of a family member, you gotta send them some type of love and hope. It's difficult to be in that room all alone. My prayer would be that the nurses and staff and doctors that are going in are just magical and full of love and comfort and really want to help the patient heal, because that's important. Like, they're there to take care of you. That's why you have to speak up and say, like, maybe you didn't think of this, not say this, but this is what I'm needing. This is what I'm needing. I'm needing no one to be in my room. I'm also needing to eat something, and I'm not getting an appetite. So can we try Magestrol? The hope and the love. The hope and the love for me, sending something. I told her, I said, get the girls together and paint something, marker something, draw something. It doesn't even matter. Send them a picture, actual picture. I sent this to the COVID patients in Pensacola. There's artist sleeves. They're just basically a plastic envelope that you close, and whatever's in there is tightly sealed because of the germs. You don't want to send more germs in there, right? So I suggested to her, I said, get the girls together, draw something colorful and send it to the hospital. Like, that's what he needs. That's what needs right now. Like, you have so much that is overwhelming you, and you can't get out of it because it's always something. There's a needle that's going in. There's a knock on the door that is not a favorable news. There are medicines that are going in that are basically sucking the life out of you, and it always gets worse before it gets better. So if it is getting worse, it's on course. It will then get better if it's being the will of God, but that's the progress. Like, the first 5 days are absolutely terrible. You think it's not working. You feel worse than you came in, and you're like, I'm done. Don't quit. Because just around, then you start kind of curving, right? You start curving. You start to get a little bit more energy and a little more hope and a little bit, okay, this is tough, but I can do this. And then at 14 days, at least for me, unless I have to do 3 weeks, it really, you start to feel so much better. You have life again, and it's this cycle that you must go through. And for me, anytime I'm there, to receive some love and hope and joy and support from the outside world, even if it's just a picture of a colorful rose, is so nice and lovely. It takes your mind off of what's happening in front of you. And anything that can take your mind off of the present pain, like crossword puzzles, or I like to color. I'm sure not everyone likes to color. Watching different series and movies, which kind of gets boring after a while. There's something that you actually want to do to activate your mind. Puzzles, crocheting. I mean, anything that for me is, doing, reading, working is so helpful. Music. I take a speaker into the hospital with me. I have like a package that I always take with me, and it is a blanket that's mine, a pillow that is mine. It's paper, books, markers, speaker. I take my tea kettle to have tea. I have these things that I know that will help me while I'm in there kind of feel like I'm still a part of life, right? We want to remind them that life is out there and waiting for them and keep them comfortable. So I hope that some of these tips help you. I know it's a life of CF is not a life of COVID, but talking to her, there's a lot of similarities within them, and really you just want to keep them comfortable, sleep, eat, and there are medications that they can take to kind of like bring down the anxiety. Hydrazine. If you want to know the name of it, I'll text it to you or message it. It's basically a really heavy duty Benadryl, like a antihistamine, but people use it for anxiety, and it can also help you sleep. You can take it every 4 to 6 hours, I think. And so I've taken that. I also do Benadryl through the IV to sleep, or if that doesn't work, I usually go to Ambien, and I do 5 to 10 milligrams to help me sleep. There are medications out there that work. It doesn't mean that you have to be on them all the time. It doesn't mean that you're going to get addicted to them. You just need something to help you through this time. And there are resources and things that they can do as a staff and a doctor to help your family member, friend, yourself get through COVID. And gosh, pray. It's tough in there. I'm not going to lie. It's tough. It's a big game to the mind, to the heart, to the body, to the soul. You've got to fight through like nobody's business, and there has to be something on the other side to fight for. Like, you have to know that there are people out there that love you and care for you. I mean, you can do it without that, but I know I have. But it definitely helps. So anyways, I hope you guys are good. I hope it helps. And if anyone has any questions or wants some advice, don't hesitate to reach out. So I'll talk to you guys.